I had leukemia when I was 5, and the treatment was really painful and scary.
I couldn't get up. I did not want to see anybody. I was extremely moody because I was on tons of pain pills.
If cancer were to be an animal, it'd be a tiger because those animals are scary and cancer is quite scary.
I'm Danielle Reddy, and I was diagnosed with astrocytoma when I was 15 months old.
I'm Denise Legacy, and I'm proud to be Danielle's mother.
I'm Don Reddy, and I'm Danielle's father.
I'm Grandma Joan, and Danielle is our eldest granddaughter.
Danielle was born. She was a good size, almost 9 pounds. She was just a normal little baby.
The grandparents hadn't seen her probably in 4 months. They noticed a change much easier than probably we could.
When she went to crawl up the stairs, she seemed to be dragging one leg a little bit.
So we went to the Children's Hospital, and then they said, we want to send her to the Tom Baker Center for an MRI.
And it was then that they discovered that she had a tumor on the spine.
It was an 8-hour surgery, and they took her whole back apart, and then they resected the tumor.
Didn't quite remove enough that it would not grow back.
And then, the journey started with physiotherapy and other surgeries, many, many surgeries.
The whole healing process was the hardest part. Like, one summer, I got so strong. I went on 3 hiking adventures, and they were the best thing ever. And I was so strong. I had to come back in September, and I got surgery on my leg. It was like learning how to walk again. It was so hard. I just wished it was summer again.
She said, well, if I'm going through surgery, then I want a tattoo on my leg. And so she's so proud. She got the Kids Cancer Care tattoo on her ankle. Kids Cancer Care, of course, has meant a lot to her for her whole life.
Camp brought out the best of me, and it made me full of life, and knowing that I can be helped, and then I can help others as well. And it made me so enthusiastic and so looking forward to life. I love seeing the world on my bike. I went on the Kids Cancer Care fundraiser, the Tour for Kids.
356 kilometers in 3 days. She doesn't have use of her left leg. It's more for balance. It's all her right leg that's doing most of the work. So it's like, holy cow, you can do anything you want to do.
When she gets it in her head that she's going to overcome something, she's going to do it.
She is our absolutely miracle granddaughter.
Cancer would not be positive at all without Kids Cancer Care Foundation, without a doubt.
It's really fun. It just kind of gives them a break from all the stuff that's going on back at home.
Kids working together is just so great because kids can understand one each other. They know what they're going through.
I meet a lot of friends. If cancer was an animal, it would be a hornet.
I'm Ron, and I'm Carly's dad.
I'm Jennifer, and I'm her mother.
We were married 9 years before we had kids.
Riley just turned 3, and then we had Carly. Everything is good. And then she'd be 3. I'd spend the night up with her, and she was in so much pain. Her arms hurt, and her legs hurt.
So we were up at the Children's Hospital.
And the doctor that saw her said, I don't know what's wrong with her, but I'm going to hospitalize her until we know what is wrong.
Dr. Singh came, said it's definitely leukemia.
We decided that hope was all we had, and that is the direction we had to go in. Because all she knows is to battle, right? Because she's a warrior.
She was very accepting. I mean, we told her she was going to lose her hair, and we asked her, would you like to donate your hair to Wigs for Kids? And she said, yeah, let's do that. So she got a haircut, and she was excited about being bald like Daddy.
I told her that once the medicine started to make her better, that she wouldn't be in pain anymore. Would have been a couple weeks after that, she said to me, Dr. Singh made me feel better.
Made my belly feel better.
Made my belly feel better, yeah.
They hit them very hard the first week. ALL patients are supposed to be in remission within a month.
Yeah.
And Carly was technically in remission, I guess, within a week. The first
8 months.
8 months are the worst.
Yeah.
Now she's in maintenance where it's
It's a little easier.
a little easier.
Yes.
It is entirely done.
Kids Cancer Care came in within 3 days of being diagnosed, offering to send Riley to camp. He loved it, he had fun, he met new people.
I felt a little bit relieved because they did things with them and they made him feel special.
When Carly went to camp this year, they've got the staff that understands that she can't eat for 2 hours, takes some chemo, and then can't eat for another hour. They let you be normal. We went out there, we spent the weekend having fun, being in the outdoors, doing everything. We came back that Tuesday, they did her blood counts, and they were at the highest level they had been at since diagnosis. So it promotes healing, I think, being out there, being in the outdoors.
They've connected you with these families and it helps you to know that they're going through the same thing, that you're not alone.
3 words I think I would use to describe Kids Cancer Care: support, healing, and family.
You have more fun things to talk about than being sick. I love camp.
Oh my gosh, I love it.